When it comes to the abdominal muscles, or specifically what's called the fascia of the abdomen with massive weight loss, sometimes it can actually be similar to women having pregnancies. So a patient's kind of build more of visceral fat, which is the fatty tissue that's around the organs on the inside of the abdomen. At a much higher weight, that visceral fat actually can expand and stretch out the abdomen. And then once the patients lose a significant amount of weight and lose that visceral fat, the abdominal wall muscles, the fascia, which is the structural layer that covers all that, can get a little bit more floppy. With a tummy tuck, we do what's referred to as a rectus plication. That's kind of the fancy talk for what people online refer to as a muscle repair. And that is something that's used to provide almost like an internal corset or a tightening of that structural layer. And what that does is ultimately makes the belly and abdomen, instead of being a little bit more like rounded, kind of like from the side view, it can make things much more flat. There's a limitation to how flat that can be. If the visceral fatty layer is still pretty prominent, there's certainly a limit to how flat you can get that. It's similar to almost trying to compress water in a glass. There's at some point, if you're trying to push the water down, it's going to start spilling out of somewhere else. And so it's a common thing that if there's still too much visceral fat there, we can sort of tighten things from above the belly button, for example, but it's going to bulge out of the bottom. We try to tighten at the bottom, it's going to bulge out of the top. It is sort of a volume issue at some point where we're not able to just get everyone completely flat. And really, it's all it has to do with that visceral fatty layer.